8:22. The Biden administration planning for an end to its practice of paying for COVID-19 shots and treatments. That shifts more control of pricing and coverage to the healthcare industry. That's being done in ways that could generate sales for companies and cost for consumers for a lot of years to come. Pete Seegert, a managing partner at PCS Advisors, joins us now on News Talk 820 WBAP. Hello, Paul. I'm sorry, it's Paul Seegert, not Pete Seegert. I was thinking musician there for a moment. Thank you, Stubby, for that. Paul, how you been?
Doing great. How are you all?
Doing very well. Thanks for joining us. I think that we've kind of anticipated this day was going to be coming, that eventually the government was going to pay for this stuff anymore.
Yeah, that's correct. This was planned, and it's, I would say, on the whole, probably not great news for the cost of insurance in the future and the cost of these treatments and vaccines. Anytime you give a vendor the opportunity to bill insurance, the cost tend to goes up. So that likely will happen as it will become, kind of hidden or buried in the cost of your insurance program.
I've never thought about it, but what is the cost of a COVID shot? Because I've gotten them all, but I've never paid for anything. What's the cost of a shot?
Well, these the tests and the shots, it varies, and it depends. Let's call it $40, but will it stay there? We've been buying massive volume and prepaying and so on, so we've gotten a very good price, and I doubt that will remain the case. We saw the same thing with testing when it transitioned from the government paying for a test to an insurance company paying for a test, and really even the government paying directly isn't the most efficient. We had testing that was on the shelves in Europe that cost $5, and our government was paying $120. And so then you look as it goes into the insurance program, and you get 8 free tests or whatever it was that we were doing in the past. The cost went up. I expect the same will happen with vaccines. It's unlikely it'll remain a $40 cost.
You have 30 million people without insurance coverage, and I would imagine that they're going to have to come up with some money somewhere. If they do get sick, they're going to have to get tested. A lot of companies won't even let you come back to work until you're tested. I'm concerned about where these folks are going to come up with the cash.
Agreed. Yep, we don't. That hasn't been solved yet. It at least has been recognized that that's going to be an issue. I would suspect we'll continue to have some level of investment on the government side to account for that, but it's yet to be seen.
All right, Paul Seegert, managing partner at PCS Advisors. Paul, thank you for coming on WBAP.